is my second semester ISM presentation. Um, for this semester, I decided to shadow a neurologist, Dr. Nishit Majmudar, who has his own practice in the Memorial Crumlin Southeast Hospital. His practice is called Neurology Association, and he owns it with his wife. Usually he sees about 10 to 15 patients a day, but whenever I go there, I usually see around 7 to 8 patients, and I go on Wednesdays because that's his busiest days. Neurology is concerned with the brain, spinal cord, and the nerves associated with them. Some of the common diseases that I've seen during my practice there were multiple sclerosis, which is when your immune system attacks the myelin sheath of your neurons. Neurons are your brain cells, and as you can see by the picture there, this is the left one is a picture of a normal neuron with the myelin sheath healthy, while the second one is the one with demyelinated myelin sheath. And this causes miscommunication between the brain and the nerves, which causes symptoms that go as severe as losing the ability to walk. Some other patients came in who have experienced strokes in the past, and basically stroke is when there's a lack of blood supply to the brain, causing a lack of oxygen going into the brain. Two types of strokes are ischemic and hemorrhagic. Ischemic stroke is when the arteries are narrowed or blocked, while hemorrhagic strokes are when the arteries rupture. Patients after experiencing stroke, they can come in with a paralysis of one side of the body, and Dr. Majmundar tries to help them, usually with physical therapy and medications that help improve to bring them back to their normal state. Um, Epilepsy, a disease that I will mention a lot in this presentation, is when the brain experiences like a lot of electrical conduction going on, causing like an electrical storm. Patients experience recurrent seizures, and they're usually treated with medications. Migraines and headaches are fairly common also. Migraines are a severe form of headaches. Headaches occur kind of like, they come and go, but migraines, they stay for a long time. And I've seen patients who come into the office breaking down crying in front of Dr. Majmundar, asking him for help because it's so severe and so unmanageable that they cannot work, they cannot go outside, they cannot live a normal lifestyle. Neuropathy, patients have like certain areas of their bodies that experience numbness and pain. Usually it's in the hands and feet. And vertigo is it's a sensation of dizziness caused by an inner ear problem. Epilepsy is a fairly common disease here in the United States. Around 2.4 million Americans have active epilepsy, and 1 in 26 people are said to develop it at some point in their life. It's characterized by recurrent seizures occurring due to unusual electrical activity in the brain. It mostly occurs in children and adults, and one of the forms of epilepsy is refractory epilepsy. Most of epilepsy can be treated by medications, and patients can deal with it, but refractory epilepsy is when patients do not respond to medications and have to find other forms of treatment available for them. 1 in 3 patients with epilepsy will develop refractory epilepsy. And with this, there's a risk of sudden unexpected death in epilepsy, the topic of my project. And it's the most common epilepsy-related cause of death. It's what it sounds like. It's sudden and unexpected. There's currently no particular method, but there's a lot of research going on behind it. So here's a picture of a neuron. The red area of the neuron is the dendrite. It receives chemical messages. The yellow areas are the axon, which sends the electrical impulses to synapses. Usually they're controlled in the brain, but in epilepsy, patients experience electrical storms in many areas at once, because in normal brains, you see when different areas of the brain are activated, the neurons are associated with it are activated, but in epilepsy, there's a huge electrical storm going on all at once, and which causes, and these impulses are sent throughout the body to muscles, causing twitching and convulsions, which basically cause seizures. The picture on the right shows the EEGs of normal, partial, and normal patients, partial seizures, and generalized seizures. As you can see, with partial seizures, only a certain area of the brain is affected. They're also called focal seizures. And with generalized seizures, many areas of the brain are affected, which causes an EEG scanning of erratic conductivity throughout the whole brain. There are mostly unknown causes of epilepsy. Around 70% of causes are unknown, and 30% are you fall into head injury, stroke, brain tumor, brain infection, alcohol or drug abuse, which also can actually cause epilepsy. As you can see, in the 1975, Huster and Perlin did a study in which they studied what cause epilepsy. And in their study, 30% were due to trauma, stroke, neoplasm, which is cancer, infectious diseases, congenital lesions, which is like lesions during birth, anoxia, which is lack of oxygen, and other cases, while the rest were put into the category idiopathic, meaning unknown causes. In 2014, this was improved, and the 70% causes that are still unknown or somehow or there is a link towards genetic causes, so most of epilepsy can be inherited from your parents. And also they included into the known study group that some autoimmune issues and focal epilepsy with MRI detectable lesions can cause epilepsy. Epilepsy usually is controllable and patients do not die from it. Patients still live for a normal span of lifespan, but there are causes that may cause unexpected death. And it's a very current hot topic in the field of neurology and epilepsy in general because doctors are trying to find ways in order to prevent patients from dying suddenly. And it kills 1 in 100 patients with severe surgery eligible patients, epilepsy, meaning that these patients cannot be treated with medications, and usually surgery is the only available method for them. It occurs more often when the person is asleep or alone, so it's really sudden and unexpected, and nothing that you can't really do anything about it to help the patient. But those studies say that epilepsy-related electrical storms in the brain have affect the regulation of breathing and heartbeat. So some think that the heartbeat is affected first, causing breathing problems, and others think that the breathing problems cause the heartbeat. So due to this, there's also criteria for finding out whether a person actually died from SUDEP. When analyzing an autopsy, you can't just say a person died from SUDEP just because you can't find a cause for it. There are certain criteria you have to follow so that you're more sure that this is SUDEP and this is something that can be studied into more deeply. The patient must have epilepsy. It must have occurred suddenly and unexpectedly. There's no medical cause behind it, and when observed, it's completely suddenly, and there was no way to kind of like there's no way that someone with the person could have like seen that, oh, he's about to like die or something. It's completely sudden, and there may not be evidence of an epilepsy at all. So due to this, I wanted to research whether in the current research how the research on SUDEP is based on and what kind of research is going on. And looking into it, I found that there's a lot of hypotheses based on the cardiac issue, that the heart is the predominant cause behind death in patients with SUDEP. And I wanted to see whether the heart leads to breathing problems or whether the person first stops breathing and then eventually dies. So formulating into my question, I asked, in persons with SUDEP, does the regulation of heartbeat become disrupted first, leading to breathing problems, or does it occur vice versa? And I knew that epilepsy there's a lot of different types of epilepsy and seizure types, and each person has a very unique experience with it. So I propose that there is no particular method behind it, and so that each person may have experience with it differently, and it may, like for some, have the heart may be the issue behind it. For others, the breathing problems may cause it. There's been a lot more research going on into the cardiac hypothesis. Michael Sperling has done research, and he's proven that a lot of patients that he's been studying have some sort of cardiac arrhythmias before, during, and afterwards experienced an epilepsy before dying. 51 seizures in 43 patients were studied, and of all the cases, 39% had one or more abnormalities of rhythm during or immediately after seizures, showing that there is indeed some kind of connection between the heart and the death in patients. There's also been research done in long QT syndrome, and basically people with long QT syndromes have have heart muscle cells with abnormal electrical characteristics that cause a person to die suddenly. As you can see by the picture here, with a normal ECG, there's a particular QT interval of a heartbeat, and it goes from around 300 to 400. But in long QT syndromes, it overgoes that span, and that's why they call it the long QT syndrome. And within that study, Annual American Epilepsy Society in San Antonio has done research, and it showed that there's a defective gene in long QT syndrome that controls the channel and cell membrane through which potassium ions flow, and the same gene was found in the brain. This gene was defectively engineered in mice, and they found that these mice had abnormal heart rhythms before death. In the pulmonary hypothesis, University of California, Davis has studied 2 SUDEP cases and 4 near SUDEP cases revolving around the pulmonary hypothesis, and they propose a mechanism based off of the observation that they've made. The patient has the seizures, which depresses functions in different areas of the brain. This causes a reduced breathing with an increase in carbon dioxide levels in the blood, and which eventually leads to a disruption of heart function. There's also been a study done on epileptic baboons in San Antonio, and these baboons have a 20% genetic predisposition to dying suddenly, and in them they found a certain lung fluid called pulmonary edema that may have been the cause behind the death, and this kind of showed that there were no heart abnormalities whatsoever, but there were more lung dysfunctions. With ethical and legal issues, there's not that many, but there is a main question the doctors ask themselves each time a patient comes in with epilepsy is whether or not they should even be told of the risk of SUDEP, because it is really rare, but those who experience it severely, those who are with patients whose medications cannot help them, may actually help with the precautions from SUDEP. But in other patients, those who have less severe epilepsy symptoms, who have mild to almost no seizures at all, they shouldn't be stressed with SUDEP at all, because it is really rare for them, first of all, and it would actually cause unnecessary worry for the patients and for the patient themselves and for the family members. But in general, I found out that doctors do say of the risk of SUDEP, but they just stress it more in patients with refractory epilepsy, which is uncontrolled by medications and with severe seizures. So in my conclusion, I found that really patients do experience it differently, and because there's so many different types of seizures and epilepsies, there's different mechanisms occur in different patients with SUDEP, and so it was proven that correct. In some patients, respiratory dysfunction could be the predominant cause, while in some others, cardiac failure due to abnormal heart rhythms could be the cause behind it. Thank you.